started.
Awesome. So good evening, everyone. Thanks for joining us for this town hall for SNDS. We're going to discuss some important topics that impact our community. Whether you're a longtime member or new to the society, we really appreciate you being here and your commitment to advancing our field and supporting organized dentistry. So this is going to be an opportunity to share your thoughts, concerns, and collaborate and just get some information. So we truly encourage you to participate and provide feedback. Just some housekeeping items. We just ask that you keep your microphone muted unless you're speaking, just to minimize the background noise. Feel free to use the chat box for any questions or comments. You can also direct message any of the presenters or Esther and myself. Oh, and my dog made it to the presentation. Thanks, Esther. And just know that this meeting is going to be recorded just for future reference and for anyone that wasn't able to make it today. So now to guide us through the town hall, you all know her. She's the heart of SNDS. She's our executive director, Esther Yosef.
Awesome. Thank you so much. Alrighty. So again, I am Esther Yosef. I've been with Southern Nevada Dental Society for almost 3 years now. I love it, and I am really excited about what we are going to talk about this evening. Just kind of an overview of what we're looking at here. I know y'all can read, so I'm not going to bore you with this, but these are the things that we are going to cover tonight. So buckle up. It's going to be a good 2 hours. Just housekeeping things. Please make sure that you have RSVP'd on our on our Ticket Spice, so that I can make your CE certificates. Additionally, make sure that I have your name as you want it on that certificate. You need to be present for the entire presentation to get that certificate, so please hang in there with us. Right. Okay, so our meeting objectives tonight, we're going to establish what organized dentistry is and what it's doing in Southern Nevada. We're identifying resources both to our dentists and the public that to improve access and quality of care. We're also reviewing current and past dental legislative efforts impacting the Southern Nevada dental community, and then to also unify and engage the dental community in our common goal to improve Nevada's dental health and the profession. Okay, so who's Southern Nevada Dental Society? We are a nonprofit. We were established in 1940, actually under a different name, and then eventually became Southern Nevada Dental Society. We provide tons of resources, both to dentists and the community, and also incredible benefits as part of the ADA tripartite. These are our vision, mission statement, value statement. This is why we exist. This is what we're trying to do. This is what we want all dentists here in Southern Nevada to get on board with, because together we all succeed. Not just to be cheesy, truly in the last 2 years, we've seen what it means to really work together as a team, not just as a society, but just as dentistry as a whole here in Nevada. We've seen incredible wins legislatively. We have made an impact on our communities, and then also on the lives of future dentists as well. We'll talk more about that later. What is the tripartite? Won't bore you too much. Essentially, we have the ADA at the top level, the federal level, NDA at the state level, and then SNDS at the local component level. When you're a member with us, you are a member of all three, meaning that you get the benefit of all three. I love these people. These are our executive board members for SNDS. I want you guys to see all of their faces, because these people, number one, truly care about this society. They truly care about their profession, and just making it better for those practicing and our patients. Right now we have Dr. Christine Lemon, our president. Go ahead and wave, Dr. Lemon. Um, Dr. Sonal Shah, I believe, is also on this call. If you want to wave, Dr. Shah, you can.
Hello, everyone.
She is our president-elect. She will be taking the torch in April here. We also have Dr. Alvin, who just joined us as secretary. We're super grateful to him for that. You can go ahead and wave, Dr. Alvin.
I did. Thank you, guys.
Awesome. And then we have Dr. Mani Amadian. I don't think he was able to join us tonight, but he is our treasurer. And Dr. Richard Shane, who is our immediate past president. You can wave, Dr. Shane. Awesome. These are really, really awesome people. They are why SNDS works. They are your voice. They are the people who are helping make decisions for this society in Southern Nevada. There are more people who are making this work. We will show them later. But if you have questions ever about the society, about our efforts, you can always go to these people and they will point you in the right direction. Okay, so your membership, what was it doing in the last 2 years? It was forging community partnerships. These are huge right now. With UNLV School of Dental Medicine, in the last year, we were able to partner with them for some CE events, which was really big. For a while there, we kind of gravitate, we we were living parallel. I guess that's a better way to say that. But we realized, hey, if we band together, we can reach more people. We can be stronger. So we did that in the last year, and we've definitely grown to have an incredible relationship with UNLV through Dr. Ma and our wonderful faculty. Many of our faculty, our board members are faculty members at UNLV. So it's been incredible to work with UNLV and all of those faculty members. And then we'll talk about this later, but working together to support those dental students. We had several events with the dental students in this past year, and they were incredible success. And it was definitely the work of our members for Southern Nevada Dental Society. Another partnership that we are starting to really develop is our Nevada State Board of Dental Examiners partnership. We actually held our first joint event to improve our licensing process. That is huge. And it's because of your membership that we were actually able to do that. We'll talk about this more coming up here, but that was an incredible event. That was an incredible milestone in our relationship with the Nevada State Board of Dental Examiners. And we've had a few meetings as well. Mariana from the Nevada Dental Association was able to meet with them last week, had a very positive meeting with them. Dr. Haruni, who's our peer review chairman, has also had meetings with them. I've spoken with them. They're starting to warm up to us and also, again, realize how important it is for doctors to come together and really change the landscape of Nevada dentistry. So we look forward to what that's going to look like here in the future. I did want to give a shout out to the Nevada Association of Pediatric Dentistry. We're so grateful that they invited us to their annual event this past weekend and let us speak about what we are trying to do legislatively. And just about what Southern Nevada Dental Society is all about. We definitely have similar goals and are trying to do similar things. One big thing that they are really trying to push legislatively is access to care. And I was like, hey, surprise, so are we. Let's do this together. So it was just nice to be able to see that there's a hard working group of people who are trying to do the same things that we are. And we hope to continue, hope to continue that here in the future. I also wanted to give a shout out to Adopt-A-Vet. I was able to meet with Grace and they have been um, they have been incredible to learn about the services that they provide for our veterans. So with that, I would love to turn the floor over to Grace.
Good evening. I'm Grace from Adopt a Vet. I'm the business development manager. Essentially, we help low-income veterans establish free dental care. I'm also going to introduce my colleague, Caleb. Caleb, hop on.
Yeah, I'm right here. Did you want me to did you want me to talk? Okay.
Yes.
Alrighty, yeah. So my name is Caleb. I am the dental program manager for Southern Nevada for the Adopt a Vet dental program. We have been providing free dental care, free full service dental care to low income Nevada veterans for almost 15 years now. We came down to the South about 4 years ago. Since then, the response has been really great. To this date, as of I believe this month, we're close to almost $10 million worth of donated care through this organization. Now we are a 501c3 nonprofit organization. We are not affiliated with the VA or the federal government at all. This is all just a private effort, very personal for a lot of us. A lot of us come from either a military background or have family members that were in the military. So it's really just kind of a thing we do to give back. So for on the provider side, how the program works. So we do vet all of our applicants very thoroughly to make sure that they do meet the qualification standards that we set, but also our board and our donors. Once they do qualify, we'll go ahead and place them with a partnering dentist. We have about 160 dentists around the state of Nevada that we partner with currently, and we are always looking for more help and more partners as it goes on. But once we determine that the veteran qualifies for care, we place them with a doctor, and the services are provided pro bono. We do cover lab costs, so any crowns, dentures, bridges, any prosthesis that the veteran needs, we do cover those costs for the doctor that is donating their time. We do also, in line with the dental board, their requirements, we do offer up to 6 CEUs per year as well for our partnering dentists. With that, thank you so much for having us. If anybody has any questions, I'm more than happy to answer.
Awesome. Thank you so much, guys. And then we do have a Q&A at the end. You're welcome to stay if you would like. But if you guys need to jump off, I'll make sure any questions are forwarded to you.
Okay, yeah, absolutely. I do believe both Grace and I do have to get off here pretty soon, but like I said, we definitely appreciate you having us come and speak with you guys.
Not a problem. All right. Thank you so much, guys. I am going to share my screen here again. I would love to introduce here Eddie Ablazer from Tri Strategies.
Oh, hello. Can you all hear me? Uh-oh.
Yes.
Yes.
Oh, great.
Yep.
All right. Hello, Southern Nevada Dental Society. So good to talk with you all. I know that we try to visit you in person, and we are in the throes of the session. Governor's staff is actually defending its updated budget as we speak, and so my team is attending and watching and participating in what we hope will be a balanced budget presentation by the end of tonight. I have quite a bit to go through, so I'll try to go slow. Please take notes. Esther, do you prefer stopping on each slide, or you want to just go to the end and then we can go back to things?
Oh, sorry. That's up to you. I'm happy
Okay.
to, if you want, we could go through the slides and you could just tell me change slide or next
Yeah,
slide.
yeah. I'll pause at the end of each slide, and then if there's any questions, we could stop there and move forward. So,
Awesome.
okay, great. Well, Dr. Lemon and team, thanks for having us. We're really excited about this upcoming session and the work that we are fortunate enough to do for the Nevada Dental Association, which is your lobbyist at the state level, and really grateful that we have another session of representing our amazing doctors of oral health, and there's a lot on our agenda. So to that point, next slide. We have currently in the works 4 pieces of regulation that during the off session, the interim, when the legislature does not meet, we have the privilege of working on bills that we got to pass for the most part, working with you all. And these are Senate Bill 393, the medical loss ratio, for dental insurance, the Senate Bill 310, EFTA, expanded functions for dental assistance, AB 147, the nationally renowned modernization of dentistry or teledentistry immunization dental home bill, our dental therapy bill regs that I was not around for, but lo and behold, we inherited the regs from that bill. The all payers database, which we've had a little bit of participation in, the student loan repayment, which is so phenomenal for our dental students down there in the South. I really hope that we can get the information the treasurer's office is pumped out on the student loan repayment, because dentists are included and have quite a bit of value there. A retroactive claim denial, which we passed in a prior session and are still finalizing that reg. And then finally, the state dental health officer reforms that took place at the state level. Next slide, because we will talk about these, but we can talk about them here. So here's where we have positioned all the bills all the regulations. The one that is still in negotiation stage is the dental loss ratio, medical loss ratio for dental insurance. Senate Bill 393 as passed. We were able to obviously successfully get it through the legislative session, work with the Division of Insurance, and now we have some pretty aggressive staff bureaucrats at the Division of Insurance who is defending and supporting our efforts and your efforts, advocating at the regulatory level for dental loss ratio. We have a couple of more opportunities for nuance and workshop for language, but at that point, it will be sent along to Legislative Commission through LCB, and we're probably not going to see that enacted into reg until this summer after the legislature ends. Everything else is waiting for session to get over for the most part, where they'll sign it either in the Secretary of State's office, sign it into official NAC, and it gets engrossed in your Nevada Administrative Code as true reg, or has to have a final approval from Legislative Commission. Just as a reminder, Legislative Commission, that second box to the right, is the final process on which regulations either pass or fail. Secretary of State does statutorily have the ability to throw back regulations into the process if they choose. I've not seen that done, but they still have that authority. I'm going to pause on our regulation conversation and tracking. Is there any questions on where we're at with some of these regs that we've worked on the past couple of years? All right. And Esther, if you see anyone chiming in, feel free to cut me off and bring us back to those questions. Let's move on to board reform. So board reform, we're very excited about the opportunities that the governor is presenting for more consolidated, more unified, more uniform policies around how our board operates. And not just our board, every board and every commission in the state of Nevada currently exist underneath the Business and Industry Division run by the Committee on, or excuse me, the Division on Committees, Boards, and Professional Development. Nikki Haig, the director, is charged with creating uniformed policies. And so that is already law. Let's go to the next slide. Senate Bill 78 has language in it that is going to refine more about what the boards can and can't do. First and most important things is the consolidation of these ancillary services, such as hiring outside legal counsel, outside accounting services, outside IT services, lobbying services, and the management for hearing officers. The bill will prohibit all boards from engaging in these outside contracts. And as a reminder to those of you, and maybe new news to many of you, your licensing board in the past has spent quite a bit of money, and we found out through a FOIA request, I think at one point it was over $500,000 that they spent in less than 6 months on outside counsel for a variety of these services. That money is directly taken from you as licensees. And as a result of that action, as well as other boards' actions, pharmacy, cosmetology, there's a couple others that were considered the bad apples of the bunch, as well as the dental board. The governor took aggressive action to change all of this. This, as you see on this slide, is what is to come should this bill pass. And this is a key part of the bill. We can talk a little bit more about, the likelihood of some of this. Let's go to the next slide because there's other aspects in the bill as well. Furthermore, the goal is to eliminate unnecessary and unneeded committees, commissions, boards that don't necessarily meet. And so the Committee on Dental Hygiene and Dental Therapy will be eliminated should the bill pass. It also has some revisions on who exists, on the Program for Oral Health Advisory Committee. And then it comes down to the guidelines around how board members are appointed, their term limits and compensation, perhaps. The goal here is that the governor's office believes it's the executive function for all these boards, committees, and coalition and professionals learning coalitions to be appointed by the governor. They serve at the will of the governor, and they could be stripped off by the governor. In the past, when the governor has been upset with some of their actions, board members have used some legal dynamics to try to maintain their membership on the board and fight back the executive office, as well as, and you go to the North Carolina case, situations where these boards have created antitrust violations within the industry. That is one of the key things the governor is trying to accomplish with this bill, is to protect all of you from situations both ways, where you might be targeted and receive unduly recognition or fate or punishment or favor that is not necessary to the function of the board. That's why it's underneath the Division of Business and Industry. So I'm going to pause on the board reform bill. Are there any questions in regards to what this bill might look like for dentistry? Okay.
I have a question, Eddie.
Yeah. Hi, Dr. Lau.
How are you doing?
Great.
How is the dental board receiving this? Are there?
So, yeah, I can't speak for all members of the board. I will tell you, it's been conveyed to me that all of these boards, I mean, we're talking about thousands of boards, commissions, coalitions, professional learning, workshops, what have you. There's thousands that exist by statute or by appointed authority. There's going to be a big effort to condense a lot of this. The dental board will stand on its own, so it is not privy to be condensed into another sort of associated board. The loss of autonomy that some of these boards are talking about, and I believe that's what our dental board has been referencing, has been a complaint. However, I think they're sort of a day late on that, right? The autonomy conversation has changed. Now they're doing legislative action to prohibit some of these functions. And in regards to, again, hiring outside counsel, I know that if this bill happens to fail, the governor and the Division of Business and Industry is going to take policy efforts and regulatory efforts to basically prohibit these boards from hiring outside counsel or firms to represent them. The idea is they are supposed to be acting in accordance as the departments that work within the state, and that does in the same way in accordance to the governor's mission. And to hire an outside counsel or outside lobbyist gives them sort of competing interest at times. So there has been critique and criticism at the board level on this bill and this effort, but I wouldn't say I heard them vote in one capacity or another to oppose it. Anything else on board reform? All right. We can move on to our access to care legislative agenda. And let's stay here for a quick second, just to give everyone a little bit about background on how we collect information from you all. First of all, you are all on an email list. You're getting emails from Esther, which means you're getting emails from Mariana and the ADA contingent as well. To that end, we have requested multiple times and iterations throughout the past year in 2024 chances to provide your input and your passion on what needs to be changed from a policy as well as regulatory and statutory level. And so in those meetings, one of the biggest points that came up to us was access to care. The fact that many patients can't see a qualified provider or they can't see in a provider in timely fashion. And so to that point, we have pursued a piece of legislation, next bill, that works in conjunction to sort of a broader access of care effort. One of our bills is, we'll talk about it in a second, is a much longer effort, the compact, which you've all heard about. We decided to approach a more short-term, next couple of years of reprieve in trying to get providers to our state. And part of that is this teeth cleaning bill that we are promoting. It's run by Assemblywoman Haiti Kasama, whose daughter is a dental hygienist out of state and has also consulted. And she's agreed to add into her bill that will have reciprocity, which is the next slide. But to this point, the opportunity to add one tiny line to our EFTA bill that passed last session. And EFTA, for those that don't know, is a training mechanism for your dental assistants to become qualified to do these expanded functions. And they can do pretty much everything except for technically coronal scaling. And as coronal scaling and coronal polishing is defined, it's almost identical except for a variation on one piece where their ability to remove plaque. And so with the workforce shortages that we're seeing, the delays in access to care, this one portion will be added, which hopefully will give you all in your offices a great reprieve in allowing your hygienists to work on those much more important cases that are backlogged in your office, and training your dental assistants to hopefully get qualified and become EFTAs so you can bill for their ability to provide a variety of expanded functions in your office and serve your patients quicker and with much more ease. The next part of the same bill on the next slide, Esther, is our reciprocity piece. And it basically allows immediate licensure of dental hygienists who are out of state, but have the same qualifications to come and practice. So if you know of individuals in California that want to come and move, that are hygienists, they don't have to sit and go through a variety of hurdles in order to practice in this state. They get immediate licensure, immediate reciprocity. So that's one of the first bills that we'll be sponsoring this session on behalf of NDA and all dentistry throughout the state. Any questions about our teeth cleaning bill, our TCB bill? Okay, moving on to our second bill. This is the Interstate Compact. The Council of Government Affairs worked aggressively with another state agency, it'll come to me, federal agency, on a variety of interstate compacts, trying to address the workforce shortages. I think it was DOJ. And through that process, they identified the significant lack of articulation and ability for individuals involved in oral health to transfer state boundaries and provide their practice, carry their ability to practice from state to state. And so what you see here is the Interstate Compact, next slide, which allows dentists and dental hygienists the ability for licensure portability. And it is only for states that recognize those that participates in the compact. And so those states are, if you go to the next slide, what you see in bluish purple, they have already enacted legislation. You see legislation pending in states close to us, such as New Mexico and Oregon on the border. And while it says no active legislation is pending in Nevada, it's because when we screenshot this, the session had not begun and the bill had not been dropped. The bill has been dropped and we are moving forward to seeing it this upcoming session. So as you can tell, there's a move to try to engage quite a few states in the compact so that individuals have that ability of licensure portability. Any questions on the compact?
Is there a way to know if there are any other states that are like Nevada that may be
Pursuing
looking
it this year?
Yeah.
Yeah, I think some of those are the green one. Well, the green ones are still engaging in it. Doesn't mean it passed the finish line. I think ADA is tracking the other states. That website at the bottom, Esther, is a great resource. It shows where some of those states might be engaging as it gets updated.
I have a question. Is there anybody opposing this bill in the legislature?
Not that we hear of yet. You know, compact bills are always fun. The Patient Protection Commission decided to pursue a universal compact for all healthcare fields. That bill included this language, but it includes in the same bill the nursing compact. And for those of you down south, I will tell you that the nurses, in conjunction, I believe, with SEIU as their union, have fought diligently and aggressively to stop a compact from coming to Nevada. And it is simple dollars and cents. Nurses on the ground don't want more nurses to compete and drive the price down. That's all it comes down to. Those of you that know SEIU, they literally say that. I mean, that's the reason they're pushing that. They'll talk about patient safety, but we, you know, also to that point is traveling nurses and nurses that tend to drive the market wages down in those regions where they have the compact. So why I'm saying that is that bill is assumed to be dead on arrival. People who had their compact included in that piece of legislation with the Patient Protection Commission are assuming it's not going to go anywhere, which is why we pursued an outside sponsor. Elaine Marzola, our champion for AB 147, is sponsoring this piece of legislation for us as well.
I have just a comment. One thing that might help in supporting this, the ADEX, the Dental and Dental Hygiene Board, I believe it's, once you pass that board, I think it's accepted in all 50 states. So if you have something that's standardized to test them on the board level for licensure, it kind of makes everybody even and equal. So if they're equal in Nevada, they should be equal to California, to Florida, Texas, everywhere.
Yeah,
there anything in the bill that states they have to pass the ADEX or a national test?
yes, I know that that is in there, and I believe it is the ADEX. I, it's been a while since we got into the nitty gritty on this compact. I mean, my goodness, there was quite a few stakeholder meetings on it, and I know that there is a national standard test that has to be passed. One of the values of a compact, when you think about portability, is the fact that each state has created a variety of barriers for outside licensure to come in. Some of those have to do with taking a 3-credit course on the Nevada Constitution. And those that don't know, that is one of the requirements that many boards, almost all boards in Nevada, had implemented in order for someone from a different state to bring their license here. Moral turpitude is another requirement. I can't define that for you, so please don't ask, but that is still in law. There's there's a Nevada ethics, which, depending on what field you're in, is valuable, and some other fields it's useless because it doesn't apply. But so the compact would essentially say, these are your requirements, these are the baseline goals. I know that in the compact there is language that says it's not intending to water down requirements on study, and so there's, if Nevada has a certain amount of hours that you have to meet for practice, you have to be able to prove that in order to come to the state. It's not going to get watered down that way, but it's the compact on that portability piece that removes some of those other extraneous barriers to come to the state. All right, if we go to the next page, you will see the work that Tri-Strategies in conjunction to NDA has done to address workforce shortage. And your state association has done quite a bit. We have everything from temporary and emergency licensure that we're also looking at, working with the board on a policy around reg for immediate reciprocity and endorsement, as well as at this state level dealing with this compact for portability. So we're hoping to get all of this passed in this upcoming session. We think that there's a great opportunity to do so. I will tell you, the hygienists have worked in conjunction on the compact. They have seemed to, unfortunately, taken a pause on our coronal scaling to EFTA and immediate licensure for dental hygienists from other states. I'm not settling for their non-engagement right now as the final answer. We're going to keep pushing and working with our hygienist association. We had such good collaboration in the past, and I don't think that should change in any way moving forward. So I don't think, I don't think it's over, but we're certainly going to keep trying to work with them. All right, next slide goes to the other issue. I think we skipped one, but there we go. So we heard a lot about insurance reform in the interim, a lot of frustrations around insurance, a variety of issues, and we're really excited about some pieces of legislation that we're pursuing this upcoming session that we think will benefit your practices and your patients alike. The first bill is this concept of an external review. Currently, in state law, there is something called the Office of Consumer Assistance, and that office hears complaints by patients and providers who've been denied claims with their insurance company, only in medical and other medically affiliated um, um, practices. In the legislation, if you read the law, dentistry is explicitly excluded from being able to utilize the external review committee and external review process for disputed complaint between the insurance company and the provider patient. And so we're really excited that the chair of Health and Human Services in the Assembly has agreed to sponsor this bill. And I think we will have hopefully support even from the insurance companies on this as well, since it gives the ability for these denials to have a hopefully unbiased second set of eyes that can make a claim, a judgment that is final and is submitted to the Division of Insurance for enforcement. Any questions on our external review bill that we're proposing? All right.
Oh, I have.
Yeah.
Sorry, I keep having questions.
Oh, that's fine.
Um,
It breaks up the monotony of just me talking, Dr. Laux, so I appreciate
okay. As far as external reviews, I had an experience. My son had a dental claim denied, and when he went to dispute it, they made him do it through snail mail. He could not do it by electronics.
The insurance company made him do it in snail mail?
Yep, they would not have it. So obviously they're just slowing down the process so they don't have to look at it as quick. They keep the money in the meantime. But if something like, that obviously should be addressed. Everything else they do is electronic, and then you get to that cannot be done electronic, can only be done through snail mail, is criminal.
Yeah. Well, that's something. Let's Esther and Dr. Lemon, let's bring that up to state level, and I think that's something my team can push towards Division of Insurance and say, is this even legal, right? And because unfortunately we hear these narratives quite a bit. We have to take that next step and sort of name names, right? Or maybe even sometimes we don't want to name names because you don't want providers exposing themselves to insurance companies and having a bias included in there. I would say if I could bring those things to the Division of Insurance, we push for some sort of written policy that we can hold on to. So Esther has that, Mariana has that, Lori has that. And when a dentist comes with a complaint, right? Oh, you guys can't do that. Here's this policy from the division, right? That's the same thing that goes back to retroactive claim denial. Insurance companies continue to try to do that. We got to hold them accountable. They cannot do that, right?
Right. It's Sierra Health. I don't mind naming names if we're naming a bad insurance company.
That's well, we'll talk about more insurance in a little bit too. Any But Esther, let's follow up on that if that's okay with you and Sarah Health. Any other questions on external review? All right, next bill that we're pursuing that we heard quite a bit is that commercial insurance and our state plans deny coverage simply because it occurs in the same day as another service that you deliver. Regardless of what medical necessity you might determine the patient in having. So I'll say a couple things here. On the 21st, I am attending making sure it's the 21st, the State of Nevada Advisory Committee on Oral Health Programs with the Division of Healthcare Finance Policy. And we are going to bring this up because there has been multiple indications that Liberty Dental, who serves the state plan and Medicaid participants, have denied multiple times patients from receiving this, two sets of services on the same day, without respect to the medical necessity that the dentist identifies. And that could be a variety of things. One, these could be very low income, hard to reach, comes in once a year patients, and you're trying to get as much work done to protect that individual's oral health. It could be truly, significant medical needs that they have to then go back to prior auth and have the patient come in the next day or what have you. Or the concerns around someone getting general anesthesia multiple times in a short period of time for a significant amount of care. So Senator Dina Neal's pretty compelled by this statement and argument as well, and will be including this in one of her pieces of legislation upcoming addressing insurance reform. And essentially, it'll just say that you cannot deny same-day care if there is medical necessity notated by a dentist. Questions on this bill? And that applies to commercial insurance as well. I know we're getting a fight on this one. The insurance companies have already called me. So Delta Dental won't even look at me in the building. That's how I know the fight's coming. All right, next bill or next slide has to do with the governor's budget. And I'm actually really excited about this. Sans any last minute changes in budgetary reform. And again, I am not monitoring the governor's presentation this evening. I believe I would have gotten multiple text messages should his new balanced budget exclude increases to adult dental care and Medicaid. But we are really excited about this proposal in the governor's budget. Early in March, I approached Division of Healthcare Finance Policy Administrator Stacy Weeks. Administrator Weeks was very excited about partnership and wanted to do something about adult dental in Medicaid and expand it. I was blunt with her. I told her that one of our biggest goals is, in order to be the tail that wags the dog of commercial insurance, we need to have a forceful mechanism that compels commercial insurance to either increase their rates or get out of the business of doing insurance for oral health. And what we have seen as a great model is some other states have also implemented something called the public option, which is a robust public plan dedicated to Medicaid eligible individuals, but caveat, it'll happen in Nevada in about 4 or 5 years, eligible for purchase from every single consumer and resident in the state of Nevada. Anyone can buy into the public option plan. And the design to this is, if we can work with the Division of Healthcare Finance Policy, which will soon to be known as the Nevada Health Authority, to increase rates, to increase adult dental care in terms of services and coverage, and then market that to all consumers. One, we will drive providers into the Medicaid space because the rates of reimbursement and the provider care will be much more beneficial. And it will create competition with our insurance companies, which is the end goal. And so this is the first step. Including adult dental in the Medicaid budget is a great step forward. I believe Dr. Benson forwarded some of those codes that are going to be expanded upon. They don't know all of them because they're still vetting those out with the budget committees. But it is a vast expansion of services to adult dental, and that is going to be the final fight that we're going to take on this upcoming session, which I think has significant long-term value for all of you. My final slide of the night, before the last slide, is we will be honoring Julie Muley. Some that don't know her, she's worked in dental assistant training for many, many, many years. It was pivotal last session in our EFTA bill. Saddens me, those that don't know, she passed away a couple of weeks ago. And she was there on the last day of session. Sine die was minutes away. We're looking at the clock, and she's sitting with me in the Senate for our EFTA bill that Senator Pico Cachia sponsored for us, and looked at the clock 10 minutes away. The bill still had not come through in a last sprint, and she's squeezing my wrist. Finally, they call Senate Bill 310, squeezes the wrist. They call for a voice vote, passes within a couple of minutes. And there was probably 60 other bills that did not pass because it did not meet that midnight deadline on trying to get through before 12 o'clock. But Senate Bill 310 did. And that was Julie Muley's, I think, great and impactful legislative accomplishment down at the Capitol. And so we'll be honoring her on April 15th for Oral Health Day. This is going to be a fluid coalition. If you look at some of those pictures, you can squint and see many hygienists participating in Oral Health Day. I will tell you this, Oral Health Day will be talking about what Julie Muley has asked us to do, and that is expanding coronal scaling into her bill, along with reciprocity, out-of-state reciprocity, and licensure for dental hygienists. That is going to be a priority of Oral Health Day. And if our hygienist friends aren't willing to support us in that effort, I'm not sure they'll be included in Oral Health Day this year. I am done. If you go to the next slide, there's my contact info. Feel free to jot that down. Please don't call me more than once a day. I'm kidding. You can call me as much or text as much, but happy to answer questions and address anything that was brought up in my presentation.
Thank you so much, Eddie, for taking the time to present for us. Also, Paul, for joining us as well. Paul Klein is a part of the Tri-Strategies team. We thank you guys so much for attending tonight and educating us on the hard work that you guys are doing. I do want to point out that Oral Health Day that's going to be happening if anybody wants to be there. Because we've seen in the past, the greatest success has been dentists themselves speaking with legislators. We can get you more information, get you signed up to join the fight that day.
And I'm sure someone might want to jump in. Esther, I want to say I want to share an amazing story about signing up and coming down there and maybe going, if any of you have a elected official that is one of your patients, how important that connection is. I was sitting in Senator Pat Spearman's office, Assembly Bill 147, Modernization of Dentistry, specifically targeting the do-it-yourself dentistry online programs such as Smile Direct Club, came in and were aggressively opposing the bill. They hired lobbyists they were smart. They hired lobbyists that were friends with Senator Spearman, that knew Senator Spearman, that had a relationship with Senator Spearman. So did we. So she calls us into the office and we're debating in front of her. And in such brilliant act of drama, she stopped everyone, told everyone, stop, don't talk, picked up the phone, called her dentist, and put him on speaker. And she's like, I got you on speaker. I've got people in the room, doctor, and I don't remember his name, doctor, whoever it was. If you are going to adjust someone's teeth through, gosh, why can't I think of braces? You know what I'm talking about. So braces, etc.
Clear aligners.
Thank you. Clear aligners, all that stuff. But you're going to move the jawline. You can move this, put clear aligners. Do you think it's important to take an x-ray of their jaw, of their teeth, of their gums, check out their gums in person? Is that important to do first? Or do you think anyone could just do it and move the lines, move their teeth, their jawline? He said, Senator, hell no. You cannot move someone's teeth without looking at an x-ray. That is malpractice. You have to look at it. Look at their gums. Is there decay? Is there disease? He's like, doctor, thank you so much. Hung up the phone. She pointed at the Smile Direct guys that were in the office and said, you guys are wrong. I just heard it from a doctor, my own dentist that wouldn't even do that. We need this. You guys are making stuff up. Get out of my office. She pretty much said, get out of my office in many words, but we just sat back. I was smiling. I looked at her, said, thank you. We left and the bill passed. So your role is super important as a dentist and the people you serve. So please come participate with us on April 15th, Julie Muley Oral Health Day at the Capitol.
Awesome. Thank you so much, Eddie.
You're
You guys
welcome.
are welcome to stay on the call if you would like. We understand if you guys have to hop off. We do have Dr. Sachs here who can field some questions too at the end during our Q&A session for anybody who needs.
Well, thank you all. I'm going to jump off, and unless there's a question for me, I appreciate all the work you do, and we're looking forward to many more victories this upcoming session for you all, and can't wait to see you at House of Delegates this summer.
Awesome. Thanks so much. Take care.
Take care.
Alrighty. So I don't know if anybody needs it, but we are halfway through this and hopefully be able to get done a little bit early, but it's up to you guys. Do you want to power through or do you want to take a 5-minute break?
Keep
Power
going.
through,
All right, let's power through. I was hoping you would say that. Okay, so let's talk about the elephant in the room here. For all of you who are on joining us by phone, I have a little elephant and someone feeding them dues. So I want to be upfront about everything. I don't like to hide anything. I don't like to beat around the bush. We obviously, to be a member of the Southern Nevada Dental Society, you do have to pay dues. So our dues in 2024 were $1,519. I'll tell you what, dues in 2025 are still $1,519. Why is that so important? We haven't increased anything, which is pretty amazing, considering a lot of other associations have upped their dues. A lot of just people in general go to the grocery store. Everybody is raising costs. And we decided not to do that to our members this year. And instead, we're actually giving you more this year. We made membership all inclusive now. Our members do not pay for CE or events on top of their membership. This is not a what do they call those things? Timeshare. So I'm not going to sit here and sell it to you. I'm going to go through as fast as possible this slide because we have better things to talk about here. So why didn't we raise prices? Very honestly, we want more people to be a member because we want your voice. We recognize that we are only as strong as all of the people we have behind us. So we made sure not to increase those dues this year. Your dues are literally what power the fuel of Nevada dentistry. This is purely just for everyone to be able to see all the following benefits. We have association health plans, blah, blah, blah. You can read all this stuff. But what we just talked about legislatively, That's massive. That's huge. Most of your dues go to fuel that. But let's take a look at some other stuff your dues also did in the last 2 years. So we have our peer review program. In a nutshell, this program is designed to take patient complaints about dental work that's been done by the provider and to try to find a fair, fast, and confidential way to deal with it. More of an arbitration process than you would obviously get at the dental board. So this is included in your membership. And then you can use this also proactively. I love to tell dentists, you don't have to wait for your patient to call me and have a problem with you. If you have a difficult patient, you can refer them to the program. And then you know that you have these other dentists who are behind you looking at that and supporting it. And let's say you did make a mistake or something like that, helping you fix it and close that out so that that's not hanging over your head and hanging over your license. In the last year, we helped 34 dentists be able to settle issues with disgruntled patients. Not all 34 had to go through the program, which is awesome. We were able to catch it early and diffuse it very fast. So Dr. George Haruni is our chairman for that. If you have questions, super cool guy. He's my dentist. You know, you can always ask him. He's awesome at giving advice. We also have Dr. Douglas Sanchez, Dr. Meredad Most, and Dr. Huai Fen. Super cool guys, amazing clinicians, and they've helped so many dentists with difficult patients. Membership.
Esther, I would just want to add with peer review. If you are not a member, the association or dental society can still hear your case, but you have to pay $2,500. So that is actually way more than what your dues are. So if you ever need to use peer review and you're not a member, you're paying really way more than the dues.
So definitely makes sense to be a member just in that respect. Membership and mentorship. So Dr. Laux and Dr. Shane, two great guys. They're killing it over there at UNLV. They're doing an amazing job. We recently had a very successful mentorship lunch at UNLV. Dr. Laux presented for us. We had over 60 students attend that. And then also we had actually had 112 who had signed up online who were interested in the program. So normally, you know, there's a point where you're like, oh my gosh, what am I going to do with 112 students who need to get placed, you know, for mentorship? What are we going to do? Amazing. Northern Nevada Dental Society, Southern Nevada Dental Society doctors came together to place all 112 of those students. That is incredible. That literally, and it didn't take that long either. So like that just shows you the incredible power of working together and the power of organized dentistry here in Nevada, that alone. Those mentors are making such an incredible difference in these students' lives. Talking a little bit about SNDS's delegation to the NDA's House of Delegates. So kind of what this is in a nutshell is a formal way to address the decisions that are going to be impacting the future of Nevada dentistry. Delegations are sent from all over, they're from the component societies, excuse me, to essentially be your voice, to bring your ideas, bring your thoughts and your feelings about what's going on in Nevada dentistry and speak and vote for you at the House of Delegates. So this is actually an extremely important meeting. We do have it up in Reno, or we switch between Reno and Las Vegas. And I just want to say a huge shout out to SNDS's delegation that had gone. Also special shout out to student dentist Tyler Divis. He didn't just sit through, he actually spoke up on behalf of the students there. That was really interesting and very cool to hear his perspective on a specific piece that was discussed at the House of Delegates. Very honestly, we need your voice. We need to hear what all of you want. And we desperately want to know what you want and what needs to change in Nevada, but we can't do that if we don't have your voice. So these are the people definitely to talk to about that, but certainly we want to see more of you involved. We want new faces, fresh ideas to keep this ball rolling. We had an incredible licensing and signing day. So I wanted to bring attention to this because I don't know how many of you listened to the governor's state address, but one thing he essentially was trying to communicate was to figure out ways to address workforce shortage and make everything run smoother. We didn't wait for the state to do this. We just found a solution for it, and it was actually really incredible. It was a collaborative effort. SNDS showed up, NNDS showed up, the NDA, and then also the Nevada State Board of Dental Examiners. We had 2 representatives from them at this event. It was really, really amazing. We were able to help almost the entire SDM class of 2025 become ADA members. I think we're still waiting on like 4 or 5 people, but that was huge. And then probably the biggest win was helping more than 60 students consider staying and practicing here in Nevada, because we gave them an easy path to licensure. We literally printed out the packets for them, took their pictures, we brought in mobile fingerprinting. We had this whole presentation going on, and a lot of students were sitting there and they're kind of on the fence. I'm not sure if I want to stay in Nevada. I'm not sure necessarily what I want to do, but they were considering getting a license here. In addition to that, we heard from the Nevada State Board of Dental Examiners, because we did this event and we started that process early for them. We took what used to be a 3 to 4 month process to get licensed, and we condensed it to now a 1 to 2 week process for those graduating students. That means they don't have to wait that many months to get licensed. They only have that week or 2 weeks that it's going to take. How many of those students now are going to consider actually staying in Nevada and practicing because we made it so much easier for them to get that license? So this is just, again, another thing where organized dentistry, we did what we said what we were going to do, and we created a solution. So thank you so much to everyone who helped out with that. Also, special shout out to Dr. Laux. He had his daughter and his son come and do photography for free for those students. That was really awesome. We also have community building events. This is gonna blow up and be super awesome because Dr. Alvin and Dr. Kamal are coming on to tackle membership and events here for Southern Nevada Dental Society. We have so many cool things we've done, amazing moments just to no longer be an island here in Las Vegas. It's very easy to just feel alone. It's a sterile, pun intended, environment at work sometimes, and you're working, go home and do it all over again. This is just a nice breath of fresh air of people who get it, who go through the same thing and do the same thing that you do. You are a doctor all day. Sometimes it's nice to just be you. And this is a really awesome community to be able to experience that. So we would love, there's some pictures here. Went to an Aviators game this past summer, the gala. We do have happy hours. We've done happy hours at Taps and Barrel, and we have some coming up as well. And our holiday party. We'd love to see all of your faces, get to know you, know where you practice, make those networking connections. I did go to the ADA conference week this past summer, which was really awesome. Received a lot of that training from the for the new Fontiva sales force that ADA moved over to. Don't need to worry about that. Unless you're having problems with your portal, let me know. I also attended the ACSE meeting. I was able to see and speak to a lot of executive directors all over the US. Really, the most valuable things that came out of that conference are things that we were able to implement this year for membership, and they did change that. So one of the things was this all-inclusive membership idea. So that idea was actually, the seeds of it were born, number one, in a conversation I had 2 years ago with Dr. Rex Liu. And he had mentioned that, you know, the SNDS had done something similar in the past and then had moved away from it. And then again, Dr. Laux actually had brought it up in one of our membership meetings. And when I attended this conference and in just speaking with other executive directors, it just really hit me that, like, I think we just need to make this as much of a no-brainer as we possibly could to be a member, because we believe so much in this mission and what we're doing here in Nevada. So that was a huge takeaway. The licensing day and signing day, the success of that, a lot of the credit goes to this conference as well, speaking with those other executive directors, seeing what other states are doing to try to address workforce issues and membership. Also empowering dentists to take back the profession. I heard a story from one of the executive directors there. He actually practices part-time as a dentist. And when we were asked, what is the big issue for dentists in dentistry right now, he didn't even have to blink. He just was like, the entire profession has been monetized around us, and we've completely lost all of our power and autonomy. And that hit me so hard. And I couldn't imagine, like, what does that feel like to have no power? There's no reason that insurance companies should be telling you how to treat your patients. You're the ones who went to dental school. So that was something that reignited a fire for me. I really want everyone else to love this society as much as the people who are already functioning in it do. One of those people is Dr. Stephen Sachs, who is also on this call. He is part of our Council on Government Affairs. He is a representative for that to SNDS at all of our meetings. These people are working very well. Dr. Sachs, do you want to explain what CGA does?
Okay, well, thank you. The Council on Government Affairs, I've been on probably for 25 years. It basically monitors any legislation that is taking place that affects dentistry or dentists. If you look in the chat box, you could all do what I do by very simply signing up for bills that have dentists involved. There's a lot of you more technically savvy than me, but that's the link. And basically all you got to do is put the word dental or dentist in the search box, and every single piece of legislation in this next session that's coming up will populate for you. And you could track 10 bills yourself. Do you want me to start getting into this kind of stuff, or I don't know where you want me to take this? You want me to do the questions?
You can go. You can go right ahead. I was finishing up.
So basically, let me give you the legislative process. Basically, you may have an idea and you may have a patient that's a legislator. You talk to the patient, you basically say, you know, this is a problem. The legislator then goes ahead and puts forth your complaint or your issues in a bill that they submit to the Legislative Council Bureau. That Legislative Council Bureau formulates a bill. The bill basically is then put before you on this Nellis link that I sent you. And basically it is seen before the Commerce Committee. Things that we do is mostly on the Commerce Committee. You'd think it would be health, but it's actually, for the most part, commerce. Once in a while, we get a health bill. So the Commerce Committee is established in both the Assembly and the Senate. The bill is heard in each one of those chambers. The chamber is then composed of other legislators, both Dems and Republicans. And as they listen to their testimony, they formulate how they're going to vote on a bill to get it either to kill it or to get it out of their committee, which will eventually go to the opposite committee. So if it's an Assembly bill, let's say Assembly Bill 52, it's heard in the Assembly. The Assembly then goes ahead and, the School of Rock thing, it's a bill. So it goes from one house to the Senate House, and the Senate Commerce Committee will listen to the bill and basically formulate their votes and their opinions, where we also have time to testify for or against whatever bill is out there. What's really important here is that, and I think you should all sign up, is because obviously you're all interested in legislation issues because you're at this meeting. Writing your legislator or those legislators that you could actually watch the meeting. You don't have to go up to Carson. You could watch the meeting online. You could talk to by sending an email to your legislators. It's really simple on this format. About your concerns, they may have said some conclusions during the meeting that were completely inappropriate, or somebody who testified that was completely inappropriate that kind of swayed their opinion or made false statements about something. You could point that out to them. And to be honest, at the end of the day, they go ahead and they look at their mailbox, and they have like for and against, and they just kind of look at all these bills. Unless we're actively participating, those bills could kind of pass on misinformation. So it's kind of up to us to keep track of that. Even though we have lobbyists who do all that stuff, it's good for us as those people who are interested in legislation to have our voice be heard. So that's kind of the process. I don't know if there's anybody who has questions. I have a few things that I wanted to say in addition, but I'd like to see if anybody has any questions about the process. I mean, there's a lot of people on here that I know that kind of voice their opinion to me, and I've heard them before. They've reached out to me. So speak now, please. We could use your input to make this a worthy discussion. So if it comes up, let me know. But I want to address a couple things that were brought up. I don't know, is Paul and Eddie still on this call, or did they leave?
Yeah, they had to hop off.
Okay. So first of all, I'll kind of work from the back forward. Dr. Locks, you bring up a great point. And just so you know, there's a bill called AB 52 that they did not mention, that basically talks about electronic claims and electronic submissions. It will be very easy. In fact, the language may even be there already. If you want to read through it, it may already be there that everything could be electronic. In fact, they basically are bonusing those of us who submit claims electronically to have your entire EOB sent to you and the check paid in 15 days if you submit electronically. That's a change in the law. And then if you submit it on paper, it's still 30 days. And they changed the percent configuration if it's late.
Can you hear me?
10% per year. Yeah, I can hear. Who is that? I see a phone number.
This is Tom Cantonis.
How you doing, Tom?
Good. It took me a little while to figure out how to unmute myself here. But just a quick question for the compact. Is unrelated to what you're talking about now.
I was
because
going
you know,
to go
obviously
through
the
that next.
units.
You're right on the compact. I got a bunch of stuff to talk about.
Now, is that saying essentially, is it granting reciprocity across all the states? And
that's exactly what it's saying. And that's what I'd like to go over. Because there's several of those states that was on that map that are not happy with the ADA. But I'll talk about that in 1 second. I just want to address this. I promise, Tom, I'll do it. Plus, if your ears are burning, I was just talking to you because one of the students at the dental school is your patient. And we were talking about you today.
Okay.
Funny you should be on the call. So I just wanted to see, there's a whole new, dentists are mentioned in this bill. So it's important that we put our input in. In fact, several of us could write this is not put out by a legislator per se, it's put out by hold on, I'll tell you the committee. It's on behalf of Nevada Commission of Minority Affairs. It's not a specific legislator, but you can, when you go to this Nellis, you could talk about situations like, you know, you waited 3 years to get paid, or something like they recouped the funds because there's a denial, things like that. If these things are brought up, our legislators listening to us can make changes right then and there in the bill. And people who are opposed to this will not be prepared, and they could see that our take should be always for the consumer. You know, we might benefit from the bottom line, but the angle of all your letters to these legislators should be for the consumer's benefit. Things will get done that way. If you're the greedy dentist driving the Beamer, they don't want to hear from you, okay? But the end result is that patients will have, you know, better benefits, because for the most part, we all know on this call that the benefits are the driving force of our businesses. There's very few in our community that could live off of not taking insurance as dentists. So are there any questions about this, or any questions about like signing up on Nellis and tracking your bills? And we'll make sure we give you the numbers. You got the SB 78, that's our new bill, and all those other regulations is old stuff. We could give you those numbers if you're interested in tracking. Those bills actually talk about workshops and regulations. That's a whole different issue. These bills have already passed. That's what they showed us initially years ago. Some of them, like dental therapy, passed. The regulations, you know, were discussed at the board level. All these different discussions were on past bills. But there's new bills coming out. The only number that he gave us was 78, SB 78. And you can put that in your tracking. And the other one that I just said was AB 52, which is also something you put in tracking. Then you got 8 more for free. So no questions? I don't hear any or see any. So let's talk about the compact. I guess the best way to deal with this is tell you the history. The history started from our ADA president, Dr. Joe Crowley, 10 years ago, okay? And what he wanted to accomplish is he wanted military spouses that, you know, like husband and wife dentist or physician and dentist, what have you. He wanted to be able to have those individuals who served in the military be able to go from any state that they are transferred to or had been assigned to be able to have their spouse practice. Well, guess what? During this whole compact thing, our president last year basically passed the Military Spouse Licensing Relief Act, okay? So we've had it in place for over a year, where the original reason for the ADA pursuing this was for military families. And that we're talking 10 years ago. This is how long stuff takes to get passed. So in a nutshell, it is turned into some other thing, some other monster that some will say, because of the fact that there's, in my opinion, this creates a two-tiered system. Those individuals who go ahead and take a board and they basically do all what they need to do for that state. And then there's those individuals who are on the compact who participate by delivering services in that state. Now, I call it a two-tier system, and many people are offended by that. But it's becoming more and more popular with people's complaints, because there's something that is began actually last year, I think it was 2023, that it began, where Marquette University, hail to all Marquette graduates, but they have a deal with the state of Wisconsin that all you need to do to get a license in the state of Wisconsin is graduate Marquette University. So what can happen with that is that the process basically eliminates the need for a hands-on dental board. Now, I have been pretty involved with the American Association of Dental Boards and their opinion on it. And when I approach the American Dental Association, there has been everything from some misinformation to accusing the fact that the American Association of Dental Boards is just concerned about making money, which it's there, it's out there. If they don't need to have the ADEX exam anymore, there won't be any funds spent. So I believe that there are many factors that our compact has not addressed. And the American Association of Dental Boards have outlined their concerns, which most are valid and most can't be refuted by the American Dental Association. Because if we all think about it, and hopefully I could generate some discussion on this, because I've talked to people from over the past week from Texas, from Arizona, that are greatly being affected by, you know, this potential legislation, even though they were, you know, shaded in the whatever color, they are not happy. Their associations are not happy, because let's think about it. Most of us are here. We have families. We have connections to our community. And I could give you my own personal experience, and hopefully it'll make you think. I have, you know, been on call in the trauma centers at UMC and Sunrise for 32 years. And I have not seen the number of cases of problematic dental complications that are coming to the ER in the past year or two now, that I've ever seen before. And the problem is this: we have dentists who come for the weekend, dentists who come on Thursday, they work Thursday and Friday, they have their license in Nevada. They work for these large corporate offices, and they sign out to a general dentist who basically say, when they hear what's going on with the patient, go to the ER. Like never before this has happened. Like I was saying before, we all live in these communities. We all participate. We're members of churches and synagogues, what have you. We participate, our kids, we are consumers in our communities. With this compact, there could be people here today and gone tomorrow, literally. And no accountability for our patients. It makes our profession, in my opinion, kind of go the run of a used car salesman. I know this stuff is being recorded. I'm sure it's going to be heard again. But the fact is, we have a noble profession. In other words, we have a responsibility for our patients' care. And we care about our reputation. We put our names on our doors. We care about our office and our people who work for us. What kind of commitment do those individuals have? Why do they want to be in the compact? What is the reason for it? You know, and these things have nothing to do with military spouses, which I am 100% for. It makes sense. Why should they not be able to practice their trade, their profession in another environment because they're forced on it because their spouse has to go to another state? In my opinion, obviously, that should be maintained. I don't have any problem with that. But there's too many loopholes in the current compact that don't address it. And I'm not the only one. There's several states bringing this to light right now as we speak in Arizona. They're talking about their bill right now. Since Monday, I've been hearing emails.
Dr. Sachs, I just want to, sorry to interrupt you.
So
we are hitting the 8 o'clock hour. So
okay.
just a time warning.
So bottom line, I'll stop talking. If people want to ask questions, or you don't have to ask questions, I'm no authority on anything. The fact is that I think we should all be concerned enough to voice our opinions on these things. And if somebody thinks I'm wrong, go ahead, tell me why. I mean, I like to just pick your brains.
So are we, can you hear me?
Yes.
So are we trying to get in this compact, or are we trying to stay out of it?
Well, that's the story. We basically, the intention was we were trying to get in it because in 2023, the ADA House of Delegates passed a policy that we would try to be getting every single state in the United States to participate in the compact. And we basically are at the mercy of the tripartite, the American Dental Association, Nevada Dental Association, and the Southern Nevada Dental Society. And as a result of that, yes, it got put on our legislative agenda. But things have changed, including the fact that the MSLA, the Military Spouse Relief Act.
I got it.
You know, so it changed. So we need to change, I think.
And I think that's, go ahead, Doctor.
It would make no sense for us to be part of that.
Right. There are some other problems. The one big thing, does anybody else want to talk about this at all? Anybody have questions? Because I could honestly, I could talk about this for like a week. Anybody else out there?
I'd like to comment. Along with military spouses, there have to be numerous medical, dental school spouses that somebody gets moved out of state, and then their spouse can't work. Obviously, there's unintended consequences, like you mentioned, just those people that come into town or into a state and do that. But how many? Then I don't think nobody has an answer to this. How many of what you're talking about, and how many people is it really benefiting? And is it going to be an answer to the work shortage?
Yeah, that's a great question. First, to answer your last question, I don't think it is an answer to the work shortage, because most of the people who graduate dental school want to start their family life and begin their practice, their profession. They don't want to like jump from state to state overnight to be practicing all over the country.
But they might not have a choice.
I understand. That's an issue. I understand. And there may be provisions in it, but there's some loopholes in the current dentist and dental hygienist compact that need to be addressed before we just completely embrace it. I'll give you one example that really is bothersome to me. For example, because I'm a specialist. So you could basically graduate from a dental school that's not CODA approved. You get accepted into a CODA approved postdoctoral program. And basically, you could get a license in any state right now. So what happens with that? Well, you and I, all of us on this call know if there's disciplinary actions, especially in Nevada, it takes a year before something goes down or something gets put into the system where you have a ding on your record. So you basically just go to another state or do whatever. That's one aspect. Another aspect is this. Oh, right now, there are, I have it written down somewhere. There are about 4 to 5 CODA approved programs for dentists graduating dental school, and their only prerequisite was graduating from high school. The University of Moldova, believe it or not, is CODA approved. University of Saudi Arabia is CODA approved. University de La Salle in Mexico City is CODA approved. In fact, they have a contract with the state of California to accept their graduates. So CODA approval is not what it once used to be. And all of us, several of us on this phone call could talk about CODA approval and, you know, what we think about it. But that's a whole different conversation. But honestly, we should look at it. And Dr. Locks, you have some great points. If, you know, you came from different parts of the world, you met in that state, and you basically, you know, want to move to another state together, there should be some provision that certain requirements or whatever. I agree. I don't have any issue with that. But, you know, and this is somebody who's coming from taking, which many of you on this call had to take the Nevada board, not even in Nevada. We had to take our boards in Loma Linda or San Francisco just to be, it's not like I'm trying to retaliate, but it would have been nice if honestly I graduated dental school and I have a license and I go anywhere in the country. And that's basically what the Wisconsin, you know, dental board has arranged with Marquette. Any state that is part of the compact.
You bring up really good points, Dr. Sachs, and this is what I really love about this community is that we can have these hard discussions and that we can have differing ideas about, you know, the direction that we should go. I'm confident that there is going to be more discussion about this one just because, you know, what Eddie had brought up, there's significant kind of pushback from the the nursing portion of this. So it's probably a high likelihood that this bill is not going to pass this time around.
Well, don't confuse that. There's that nursing compact bill has nothing to do with our bill.
Interesting.
That's another bill that's being presented. On top of the fact, we have our bill. Dentists are included in the one that he was talking about the nursing compact being dead on arrival. That has nothing to do with our bill. Our bill is a separate pursuit that we are, you know, actively engaged in with the chairman of the Assembly Committee on Commerce, which is the committee that if it passes, it's going to pass just because it's her bill. It's going to get through. She's in charge of the Commerce Committee. So we could send all the letters we want, testify, whatever.
Mm-hmm.
And she's going to pass that bill because it's everyone in the room that is with her and wants their bills to pass are not going to oppose it. It's politics. It's a game.
Well, if there are doctors on this call watching this who have more questions about CJA, have more questions about those bills, have differing points of view or similar points of view, is it fair to say I can send them to you, Dr. Sachs?
That's fine.
Awesome. Okay. Oh, go ahead, Dr. Laux.
I just have one last comment. For any of the wet-fingered, wet-glove dentists, Well, see, I aged myself there. Wet glove dentists that have any issues with insurance or anything, let one of us know. Esther, me, Dr. Sachs, and because it's those examples that lead to bills being drawn up. And the more people that express the same injustices that they're suffering at the hands of insurance companies, we need to know that. And even if it's a one-time thing, the more the merrier. But anything that's happening to anybody in their practices, please let us know. I don't practice, just teaching now, but so we need to know what's happening out in the field. We'll be your voice. We'll take it forward. But believe me, anybody, you dentists that are working every day, let us know. We will take your word forward.
And another point is, if, like, for example, you may disagree, and hopefully some of you do, disagree with some of the things I said, let me know, because I don't represent me. I represent the will of our organization. So as we debate things, hey, if I lose the debate, we go with whatever we're supposed to do. I mean, the will of our majority of our individuals. I am here to help. I know the process. I've been doing it a long time. And to be honest with you, whatever I could do to recruit some of the younger people on this call to kind of like move into these arenas to get the message out there that, you know, dentistry is concerned about certain issues, you know, we need you badly.
I'm glad you brought that up, Dr. Sachs, because that actually segues really good into my final slides here. We want to be the voice of Nevada dentistry, and all of these amazing bills that you saw, all these incredible efforts, all these amazing people who are working so hard right now, SNDS is literally representing only 23% of the practicing dentists here in Southern Nevada, approximately 23%. And so we can't be that voice without the voices. So I really hope that in seeing all of this, I hope we raised an eyebrow or two at least to see, okay, they're actually doing something. These dentists are actually working hard to make these dreams a reality, and we're succeeding. You know, we stunned them legislatively back in 2023. I'm hoping that 2025, we're going to go for the KO, but we can't do that unless we're all doing this together. And you know, the all of these bills, and all of these things we've done don't exist if we don't exist. And 23% is a lot closer to not existing than crushing it. So we would love to count more of you among us. If you're already among us, you're awesome. We want to see you at our events. We want to see you involved in making a change in Nevada dentistry. We already talked about the Oral Health Day. We need you guys. We need your voices, whether you're writing in or whether you're actually attending. Please let me know. I can get you signed up. We already did our Q&A. I want to thank everyone. We do have a full calendar this year and more to come. So please consider showing up in person so we can get to know you. We can get you plugged in. Thank you so much, everyone, for attending. Are there any other final questions before we call it a night?
You know, I do have one more question.
Yeah.
On the SB 310, and Steve, maybe you can answer this as well. What's the likelihood of that going through? The SB 310.
I could tell you that that was another one that was exactly that we basically had the ADA approve this entity, and as they approved it, we adopted it. The thing that we're trying to get done without it is the fact that this SB 310 kind of goes with the teeth cleaning bill that Heidi Kasama is presenting. So the teeth cleaning bill basically could potentially be eliminated by writing regulations to have the statute be more meaningful, such as putting in details like can use an ultrasonic scaler to stay super gingival, something to that effect in the regulations, and monitoring like the ratio of doctors overseeing EFTAs. Those are things that we could kind of get away from even presenting the teeth cleaning bill by just writing the regulations to specifically address the bill that was passed in 2023.
So then would these essentially expanded function assistants be able to do dental prophylaxis?
Yes. Yes.
Okay.
So I don't know, how much time do we have? So there's another thing that the ADA has already approved back in the 70s called the Alabama model. The Alabama model is something that basically allows dental assistants to be overseen and trained by their dentist. They have to take some courses, like at a university or a community college, and then they are become hygienists within a shorter period of time. That has been discussed. The Alabama model is part of the ADA policy, so it's easy for us to adopt, and it's easy for us to sell it this year because it's the fastest route to get an expanded function dental assistant. Basically has to go back to school. Not as much as the Alabama model educational component. So there's another aspect to it. So there's a lot of things, you know, balls being juggled right now, trying to get the exact verbiage. If we could probably incorporate it into that EFTA bill, which is a regulation that we don't have to use our political clout to expend the efforts on a whole new bill.
Dr. Sachs, are your CGA meetings open to dentists who would just be interested in sitting in on them?
I think if you asked our chair, I think that I don't
It's
see why.
David White, I think, right?
Yeah, I don't see why
Okay.
it couldn't be.
I
think it's important to invite everybody out there because we get opinions, and be honest with you, not too many people are talking at those meetings.
Well, Dr. Cantonis and anyone else who is interested in more, I'd be happy to forward your interest onto David White, who is the chair. And maybe we could get you guys sitting in on one of the CGA meetings, and you can talk more about these issues and definitely forward some of your own thoughts and ideas that you might have.
That'd be great.
Awesome. Is there anybody else who might have any questions before we close the evening?
Can you hear me?
I can hear you. How are you doing, Dr. Harris?
I'm doing well. I just texted a message over.
Okay, I got your question. So that applies to licensing by credentials, and you're correct. You have to prove that you're board certified, and you basically get your license. You're absolutely right. There's all these caveats. The thing is, you can graduate your ortho program, and then 6 years later, you have to, if you're not board certified, you're going to, it's like a temporary license. So, and it goes with every specialty, but it's an opportunity for entities to hire you for a few years. Maybe you have a spouse that wants to go to dental school. So you got your 6-year license, you come here and you basically practice. And then when they graduate, you leave. Because you got your license, you did what you had to do. But it's a different statute that you refer to about having to show that you're board certified to get your license.
Gotcha.
Thank you for sharing that. If it's all right, if anyone else has any questions or thoughts or even comments, please feel free to call, text them to me. You can email me as well here at the society. If I can't answer it, I'll make sure to forward it on to someone who can for you. We do appreciate everyone being with us here tonight. Going through all of these incredible wins that we've had, and we certainly hope that we will actually see you all in the future. This concludes our SNDS Town Hall 2025. Everybody have a great evening.
Thank
Thank
you.
you, everybody
everyone.
that participated.
Thank you.
Yeah.